Hi everyone, I'm Ajwa Chimerting from the National Minority Quality Forum, and this is For Your Health News. Your health, your news, your power. And I'm sitting here with Paule Joseph. Could you introduce yourself?
Sure. I'm Paule Joseph. I am an investigator, and I am originally from Bethesda, Maryland.
Welcome, Paule. We're so pleased to have you as part of the 40 under 40 class of the National Minority Quality Forum's Minority Health Leaders. Congratulations for everything that you've achieved in your career. And, this is an interesting time for us. I think that generally folks are looking for leadership in a lot of ways, including in healthcare. And we're so excited because this class, we feel, have leaders from all sorts of disciplines. And so I would want to ask you, particularly during this time where there's a lot of either misinformation or folks are wondering about access to care, what would you say to others in your class or other health leaders about what they could be focusing on in their career and how they could be using their platform at this time?
That's such a wonderful question. One of the things that I would say to either the current class or previous classes like mine, I'm class of 2020, so I happen to be in the middle of the pandemic, is that, just to focus on your passion, and focus on building the curiosity of what drives you. That will never change. No matter how the climate changes, what drives you never really change.
That's
because
true.
It's really within you. And that is what's going to help the community. That's what allows us to really do the day-to-day that we need to do. And then we can also provide the community with the right information that they need.
Right. What would you say has driven you to this moment? Could you share a little bit about your personal story, about why you chose your career and what, drives you on a daily basis?
So I am a trained nurse. I'm a family nurse practitioner, and I also did a PhD in genetics. So I run my own lab, doing a lot of work, primarily focusing on the chemical senses. So I studied the senses of taste and smell. So it's really an area that most people don't study. But one of the things that really drove me to that area in particular was really working with patients. So working with patients, on the bedside, working at the nursing home, and seeing how patients will sometimes spit their medication. And often will say, they're just not adhering to their medication. But often we really didn't think that the medication really tasted too bitter, right? So those changes are happening with age and how they influence nutrition, but as well as something that we do on a day-to-day basis clinically, like provide medications to other patients that we have. And that's one of the things that motivated me, but also one of the things that really motivates the work that I do as well is the fact that these particular senses are not measured clinically, especially in underrepresented minorities. There's really not a lot of tools out there. So one of my main goals is how can we embed this into primary care settings and have screening tools that can allow us to detect diseases earlier. For example, Alzheimer's, Parkinson's disease that is affecting our communities.
Wow. Okay, so much to delve into. Let's unpack that in 3 ways. One is, I would love to learn a little bit more about the screening tools that you're talking about. I don't think a lot of people know what exactly you mean. Could you share exactly what that looks like in a primary care setting?
Yeah, no, that's a fantastic question. So our sense of smell tends to be affected at least 10 years earlier for individuals that have Parkinson's disease, for example. So if we can have screening tools that allows us to say, okay, this individual has a decreased sense of smell, we have to monitor them over time a little bit more. That can at least tells us a lot earlier that this person is a particular risk. However, right now, we really don't have anything embedded in clinical care.
Wow.
So if you get sick, you probably will be sent either to a neurologist, to an ENT, and it's very few individuals that actually do this test. most of it is relies into clinical research.
You know, Alzheimer's is such a tough disease, particularly in communities of color where maybe we don't understand the signs. Could the screening tools that you're mentioning help with that process and be something that helps this community that often underdiagnoses and misdiagnoses this issue?
Absolutely. And sometimes it's things as simple as noticing how maybe your grandmother's cooking has changed, right? And often they're adding more salt or sugar to the food. And you're like, oh, it's salty.
You know grandmother wouldn't get that wrong, right?
Right. You know they wouldn't get it wrong. So when you notice those subtle changes, it tells you that something might be wrong. And sometimes what's wrong is like their sense of smell. Because the sense of smell and taste are very much linked.
It sounds so simple, but yet it's complex, isn't it?
Totally.
You mentioned lack of measures, you know, in order that currently exist. What needs to happen to change that?
Policy. There needs to be a lot of policy change in, you know, who reimburses for these tools that we are developing. We need things embedded, as I said, in primary care, but also neurologist offices. So sometimes we're asking for a little bit more to be done, but however, it's things that can help the community in general.
Right. Is this something that an average person can ask about or inquire about? What should the average person do if they're interested in this?
Yeah, one of the things is like if you notice that there's a change, there's advocacy groups that are primarily focused on this area, like the Smell and Taste Association of North America, for example, where you can learn more about what to do, where are the clinics where individuals can go. But if you notice a change, don't just attribute it to like, oh, you know, like this is just extra salt in food, but just if you notice a pattern, to really start asking even the primary care doctor. Sometimes it's just asking that question that pushes an inch of curiosity.
This is so interesting, but I have one last question for you, and that is, you mentioned that not a lot of people know about this practice, you know, in health. And of course, representation is so important to be able to determine things like taste, especially kind of our food, you know. We have a different level of pepper, maybe a different level of seasoning. I'm just so curious about the importance of representation in this field. Is there a ton of representation of communities of color in this field?
Sadly, not. I mean, I think as you asked the question, you probably already knew part of the answer. And that's part of like the goal. It's like, how can we increase representation where we're not using only weird population, Western, European, or populations in studies, but we're also considering diverse communities. So one of the things that we were able to do during COVID is we created the Global Consortium for Chemosensory Research. So it's a consortium that includes individuals from 66 different countries. So
Wow.
we were able to do studies across all these countries. And that was a way to really increase representation from individuals in Asia, Middle East, as well as other underrepresented groups. So at least the needle is moving, but we do need more representation, not only in the population that we study, but also on the researchers that are doing the work and the clinicians.
Well, I want to just also say I commend you because you're class of 2020 and you're here today helping to welcome the class of 2025. How important is it for you to sort of continue to be a mentor, and what would you say to others in the future who will be the incoming classes of the 40 under 40?
Not to give up. Sometimes the world can look a little challenging, but just to keep focus, and as I said earlier, just to seek that inner curiosity that leads to questions, and not to give up on that neither. Because the day that we give up not only on ourselves, but we give up on our communities.
Wow. Thank you so much, Paule. It's nice to have you.
Thank you.
We'll see you again, right?
Absolutely.
Okay.